The following is a preview of the classroom presentation material provided for each topic in our courses offered through LearnMedicalCodingOnline.com. Enjoy. Okay, so the introduction to ICD10CM, which stands for the International Classification of Diseases 10th Revision Clinical Modification, which is compiled by the World Health Organization. What is coding? Coding is transforming verbal descriptions of diseases, injuries, conditions, and procedures into numeric designations. ICD10CM is the medical classification system used in the United States for collection of information regarding disease and injury. ICD10PCS is the medical classification used in the United States for collection of information regarding hospital procedures. So that's a totally different class than what this is. And then we also have CPT4, which is for physician services, and we have HCPCS, which is for supplies and services. So those are your four separate coding descriptions that you should know the difference between. You will be asked at some point. HCPCS, HCPCS. Supplies and services. CPT4 is for physician services. Okay, the ICD is revised and new codes are implemented twice a year, every April and October. The ICD10CM manual is published in a 2-volume set, so the book actually has an alphabetic index and a tabular list. And the ICD10PCS also has 2 volumes set up very similarly to the ICD10CM. Also, I'm stopping from the notes for a section just to tell you other things that are in your manual. Okay, so you have a neoplasm table, you have a drug table, you have an external causes index. What else? Can you think of anything since you've been through it? What are some things that you have tabbed in your book already? If you have your book out, do you have anything tabbed? No.
I know what is a common thing, disease, pregnancy, uterus.
Oh, so terminology that you want to. Okay. Okay. Oh, guidelines in the front of the manual. That's good. So yeah, those are the basics that you should have tabbed out are the guidelines, and then each time you go through the guidelines, highlight a different section of that. So if you have to refer to it, it's easier to find.
Yeah, endocrine poisoning.
In your guidelines?
Yes.
Yeah, good. You should have an alphabet tab on your alphabetic index, a tab on your tabular index to make it easy to go from the front of the book to the back of the book. You should have a tab on a neoplasm table, a drug table, external causes index. Okay, so if you can have those each tabbed out, when you're using them, it goes a lot faster. And then, of course, you can put as many tabs in there as for things that you found you're using more often and tougher to find. Okay, we all good? Back to the notes. Okay, so formatting of the alphabetic index. The alphabetic index includes entries for main terms, subterms, and more specific subterms. Main terms identify disease, conditions, or injuries, and subterms indicate the site, type, or cause for those conditions and injuries. Main terms are set flush with the left-hand margin. They are printed in bold type, and they begin with a capital letter. Page 2. Subterms are indented, one standard indentation level to the right and under the main term. They are printed in regular type. They begin with a lowercase letter unless they are, what do you call that, formal? A name of something. Or if it's an eponym, yeah. Okay, and then more specific subterms are indented even farther and farther to the right as needed. They're always indented by one standard indentation from the preceding term and listed in alphabetic order. Okay, so let's take a look at the example I pulled from the book that says malaria. So find the main term for malaria. So malaria is the main term, and it starts with the subterms with, accidentally, algid, cerebral, and so on down through there. So those are all at the same indentation level. Underneath with, you could have black water fever or hemoglobinuria. And then even under the black water fever, you could take it as far as if they had the hemoglobinuria in order to find the correct code that was listed. Okay, so it's all going to be dependent on the information that we're given. Next page of notes starts with alphabetation rules. I can never say this word, so I always say it quick. So the alphabet rules go letter by letter, and the system ignores single spaces between the words, any hyphens within the words, and the final S's in possessive forms of words. Not anything you need to know, but just the facts. Numerical entries, subterms for numerical characters and words indicating numbers appear first under the appropriate main term and subterm. They're listed in numeric order rather than alphabetized if they were in their spelled out form. And then connecting words are used to express relationship between a main term and a subterm. With, subterms preceded with or without are not listed in alphabetical order, but they appear immediately below the main term and the subterm. Subterms beginning with other connecting words appear in alphabetical order, such as in, due to, and associated with. So let's try some practice on the next page with examples of what I've pulled out of the alphabetic index. These are three similar examples, but it's going to code differently. So if you were referencing bursitis in your alphabetic index, what would be your code? Okay, so M71.9 would be the best that you could do. Number two, if I was given more information and we had infective bursitis, what would be my code? M71.10? But yes, perfect. Hey, you say it differently than I do, that's all. You knew the right answer. Okay, so even more information for number three. We have infective bursitis of multiple sites. M71.19. Yep. Okay, so the more information we're given, or the more words we can use in order to find an answer, the different code is going to be more descriptive. Continuing with the practice on the next page. Number four, we have pain. What would be the proper code if we were referencing just pain? R52. But if we were going to code chronic pain? G89.29. How about chronic postoperative pain? G89.28. Am I going too fast for you to type? Okay, how about joint pain? M25.50. Okay, and knee pain? Okay, so M25.56, and then it has a dash there, and we're going to learn that dash. Okay, so there's your brief preview of our classroom material. Each chapter contains notes with voice instructions, practice examples, and quizzes. When you visit our site, you'll see links to course descriptions, syllabi for each course, and the required manual for that course. These are college-level courses offered at a fraction of the cost. If you want to learn, we teach.